This is Dr. Daniels, level 4, and we're going to be talking about DIC, disseminated intravascular coagulation. All right, so what is DIC? Disseminate, the D. That means to basically disperse throughout or spread. Intravascular, inside the veins or arteries. And then coagulation, solidification of the blood, right? Clots. So basically, it's the spreading of coagulation, spreading of clots through veins and arteries. And this happens in every microvascular of every system. Every system. So what isn't it? It's not a disease. It's a condition. This is your body's abnormal response of the normal clotting cascade secondary to disease. So it's not a disease itself, but it's a result of some other type of disease. What causes this? They can be acute causes, subacute causes, or chronic causes. Some acute causes are shock, sepsis, hemolytic, OB, malignancies. So hemolytic is like when you have unmatched packed red blood cells. It's a big reason why we have 2 nurses check. OB is things like preeclampsia or HELLP syndrome. Shock happens because the cells break open, the collagen is exposed, which attracts clots, and it also tissue damage. Subacute malignancies, OB, and chronic is things like liver disease or systemic lupus, also malignancy. So again, not a disease in itself, but it's a condition. The normal clotting cascade responds abnormally to some kind of disease. So what's going on? There's the trigger event, right? Something happens. You have a malignancy, you have shock, you have sepsis, something happens. I apologize if you can hear my dog jingling in the background. So you have this trigger event that happens, and your normal coag mechanism gets sent into overdrive. IV thrombin is produced, and that turns fibrinogen into fibrin, which enhances the platelets from coming, to come together. And it's deposited into capillaries and arteries. Thrombuses are formed, and you get multi-organ failure. So basically, normally when there's a clot, the body sends, let's go back a second. At the same time, normally when there's a clot, the body sends out these fibrolytic agents to break up the clot. So your normal coag system's in overdrive. It's thrombin, fibrinogen, fibrin. Platelets are aggregating all together. You're forming all these clots. Thrombus is forming in all the little capillaries and arteries within all the organs. So your body's going to respond. It's going to say, okay, we have all these clots, so we're going to send out these fibrolytic agents to break up the clot. And these fibrolytic agents are like your fibrin split or fibrin degradation products. So you'll see FS, FDPs. So they have anti-coag properties. They inhibit the clotting. But you're using up all your clotting factor, right? So the blood loses the ability to clot, so you're bleeding. So because you have this, because the coag system is in overdrive and it's just going crazy producing clots, your clotting factors, those FSPs, are all used up. So they can't fight against the clots anymore. So the clots are there, but now you're bleeding because you can't stop the clots anymore. So what kind of manifestations are you going to see? Obviously, if you try to put an IV in, you're going to have hemorrhage. You're going to notice ecchymosis, petechiae. You can have nosebleeds and gum bleeding, so they have to be really careful. They can't brush their teeth. They might just have to use swabs, because if they brush even just a little bit, not even hard, they could bleed out from their gums. GI bleed, intracranial bleed. They can get blood in the urine. They can have bloody sputum, respiratory congestion, dyspnea. Thrombolytic manifestations, they can get gangrene or ischemia, right? Because, so they're bleeding. They're bleeding because all their clotting factors have been used up, but they have these clots that have already been formed and sent out into the capillaries and into the arteries. So once these clots are in the arteries or in the capillaries, anything beyond the clot is not getting blood. If it's not getting blood, it's not getting oxygen. Then it's becoming ischemic. So they're going to die off. They can get a paralytic ileus because the bowel is not getting blood. They can develop ARDS, decreased urine output because the kidneys are not functioning, and even coma. So here's the picture that's in your book that talks about what's going on. So the events leading to thrombus right here, you know, all the circulating thrombi, they occlude all the microcirculation in all the organs right here. So circulating, going to all the organs. And then the events for bleeding, basically the body's consumed all the platelets and can't fight against the clots anymore. All right, so diagnostic studies. FSPs are what we talked about, those fibrin split products, and you don't normally see them, but an example of that is D-dimer. So you're going to have increased FSPs, positive D-dimer tests, which you don't normally see. You're going to have platelets that are decreased, right? You've lost your clotting ability, so if platelets clot, then you would expect not to see a lot because you've used them all up. Fibrogen is decreased. Your PT, PTT is increased, right? The PT, PTT, INR, they represent the amount of time it takes to clot. So if you're not clotting, the time is way increased. So what are some nursing diagnoses? Ineffective peripheral tissue perfusion related to bleeding or sluggish or diminished blood flow secondary to thrombus. Tissues can't get perfused if they're blocked from a thrombus. Acute pain related to bleeding into the tissues and diagnostic procedures. Decreased cardiac output related to fluid volume deficit. If they're bleeding out, right? They can't clot. Anxiety related to fear of the unknown, disease process, diagnostic procedures, therapy. So what are we going to do? We need to stabilize this patient, right? They have clots, they're not perfusing organs, they're not perfusing distal areas, but at the same time they're bleeding out. We need ABCs. We always think ABCs. So oxygenate. We need to replace volume. Typically that's done with FFP or cryoprecipitate. We need to treat the cause. We talked about the platelets, the FFP. Those are clotting factors. Packed red blood cells. Now, oftentimes, so people get confused about this, but they oftentimes go on a low molecular weight heparin. And people are like, well, why? They're bleeding out and heparin will cause bleeding. But yes, you remember there's two things going on. The clots are present. And with those clots present, they can't get blood perfused to the organs. So they may need to be on a low molecular weight heparin to break up the clots that are there. But they also need clotting factor to help stop the bleeding that's happening. because they've used up all their clotting factor. Eval. So how do we know we've done a good job? Well, all the bad things from DIC go away. We keep the patient alive, right? They don't die. We maintain tissue and organ perfusion. So if we know the brain has perfusion when they're alert and oriented. We know the heart's perfused when they don't have chest pain, when they have good cardiac output. We know that the lungs are being perfused when they're nice and clear. We know the kidneys are perfused well when we have good urine output. So again, we want to know that they're maintaining volume, and again, that's going to help with cardiac output. And we want to make sure that their tissues and organs are getting perfused. So it is short and sweet, and can be a little bit confusing because, like I said, you have these two things going on. But just go back to, let me go back to this slide. Just remember, there's two things happening. You have a trigger event that makes your coag system go into overdrive. So you use up all your coag, you use up all your like platelets, all your clotting factors are used up. But at the time they've formed clots. These clots are out in the veins and arteries, and capillaries and arteries, and they're blocking perfusion. But because you've used up all your clotting factors, you can no longer form a clot and you just start bleeding out. All right, so, and again, we know this is kind of a crazy semester, so, we'll be able to answer any questions in class, and we will be going over things in the roundabout, going over case studies, doing Cahoots, and that kind of stuff, just to make sure we drive home the points. All right, have a great day.